Hello, doctors. Namaskar. Assalamu alaikum. So, welcome to this recall session of pharmacology as well as microbiology. So, Dr. Salman here, your drugs and bugs faculty. So, in this session, we will be discussing obviously the questions, or more precisely, the topics that were tested in this examination. As you all know, it's a recall session. So, obviously, the language of the questions will definitely differ. I've tried my best to compile as appropriate as possible whatever might have been asked in the exam. So anything that might be wrong, it's my humble request to all of you to please correct me in the comments so that this can be beneficial for the upcoming batches. All right. So without any further ado, let's begin. So question number 1, my friends, a patient who was started on haloperidol developed torticollis and muscular dystonia. What is the best management of this patient? Now, you must all be knowing that when we start a patient on antipsychotic medications, they get certain side effects called extrapyramidal side effects. And one of the earliest manifestation of which is something called muscular dystonia, where the muscles of the body starts contracting. And if this side effect starts, you're not going to stop antipsychotic medication, rather treat this side effect. And the medication that we are going to use to treat this side effect, it is none other than your benztropine. And if you pay attention, this is the exact question I have discussed in my last 25 important MCQ series. Exactly, you can see a patient who was started on a drug like haloperidol developed something called EPS, extrapyramidal side effects, and I asked you what is the treatment that you're going to do. Pretty much exactly same question came in your exam. Benzhexol or benztropine, these are the drugs that we are going to use in the treatment. Even in the session before that, I had a question on this, which is an image-based question. You can very clearly see torticollis being mentioned there. So that means it was a question from our expected series. So second question, my friends, a pregnant lady in her first trimester requires anticoagulation therapy for DVT. Which one would be the most likely prescribed medicine for this case? The answer to this is heparin. Once again, if you have watched my 25 important question series, this was the exact type of a thing we have discussed. First trimester, see the question that we had put, first trimester, a case of DVT, what are you going to use? I have very clearly explained to you back then that we must be using something called low molecular weight heparins. This is going to be the treatment. So once again, the God has been kind to us that a lot of questions has showed up from the topics that I had discussed with you earlier in the 25 important series. Which of the following ATT can cause defect in the eye as an adverse effect? There are 4 drugs that we use in TB, which we all know by the name of HRZE, which stands for isoniazid, rifampicin, pyrazinamide, and ethambutol. E for E, that is eye-related side effects, are related to ethambutol. So straightforward MCQ. Surprisingly, once again, if you see in the 25 important series, we had discussed that, all this TB drugs, and I told you that these are important, the side effects, etc. Anything can be asked. And you can see one of this was a question. Which of the following anti-diabetic agents can cause glucoseuria? The answer to this is canagliflozin or any other flozin that might have been given in your exam. Surprisingly, if you see, I had discussed this in 25 important series that there was a question on canagliflozin. I explained to you all about this drug, and I also gave you one mnemonic to remember this, that when you give this drug, glucose flows in urine. What more do we need, dear friends? Next question. A patient presented with ptosis that gets worse by evening. The patient was diagnosed with myasthenia gravis. Now, I'm not sure if they had mentioned the question if the patient was diagnosed with myasthenia, or you had to do the diagnosis by the wording like ptosis and the patient getting worse by evening. So anyway, if that was given or not, irrespective, if you have diagnosed this as myasthenia, we have discussed this several times during our class that this is a very high yield topic. So what is the treatment for this case? So as we all know, the drug of choice for this is going to be pyridostigmine. So there is a mistake in the typing. Once again, a question from our 25 important series where you can see I had made a clinical case question where you have all these things like the patient becomes worsened by the evening period. All right. Next, another thing that you can see is how to diagnose this. The patient will complain of ptosis, diplopia, etc. So anyway, what is going to be used in the diagnosis? That was my question. It was not just explained to you how to diagnose. I had explained to you the diagnosis is called tensilon test, where we use the drug edrophonium, and very clearly you can see the treatment was discussed where pyridostigmine is the best drug. A pregnant female who has been an asthmatic patient presented with a blood pressure of 160 over 100 mm of mercury. What is the drug to be used in this patient? Watch this table we had discussed once again. In this, I told you whenever there is an emergency in hypertension topic, you must address is the person pregnant or non-pregnant. So if the person is non-pregnant, then the drug of choice is nicardipine or the alternative is nitroprusside. But if the person is pregnant, then the drug of choice becomes labetalol. But you also must know that beta blockers are contraindicated in asthmatic patients. So for this reason, I can't use labetalol in this patient. So what exactly am I supposed to do? I cannot use beta blockers, whether it is IV, whether it is oral, right? ACE inhibitors in general are contraindicated in pregnancy, as we know. So the only option that I'm left out with is nifedipine. I guess oral nifedipine was given in the option, irrespective whatever. By ruling out, this becomes our correct answer. I had given one question just in our last discussion of 25 important series that beta blockers are contraindicated in asthmatics. So that was pretty much the same thing repeated but in a different fashion, that's all. A patient having history of CHF was prescribed thiazide diuretics, after which the patient developed hypokalemia. Which of the following can be added to prevent the potassium loss in this patient? So simply put, they're asking which of the drugs can save potassium. So the answer is pretty straightforward, potassium sparing diuretics. And if you pay attention in this entire list, this drug is the potassium sparing diuretic. Of course, this is slightly different from what you might have expected options like spironolactone, which everybody knows. So examiner also has played little bit of game, right? So they have asked something that is instead of spironolactone, something called as amiloride. Now this is the whole idea of this examination, right? Expect the unexpected. But it wasn't unexpected after all. If you see here very clearly, once again, we had discussed in this series, potassium sparing diuretics. We must remember by the mnemonic SEAT, where the A was amiloride. Once again, the all favorite diuretic called thiazides come back again. Thiazides diuretic work on which of the following channels in the DCT? So same place, if you can see last question where we have seen, this was one chart I had given you so that you revise the diuretics topic easily, and I told you it's a guaranteed question in examination. And as you can see, two questions came. Last Fmge exam, they have given a picture of a nephron. They pointed an arrow towards DCT and they asked which diuretic work here. Obviously answer was thiazides, and this time slight difference, they have given which channel does this drug work on, and the answer is sodium chloride transporter. Going back to the question, thiazide diuretics, they work on sodium chloride transporter. If you see sodium potassium 2 chloride, this is where the loop diuretics work. ENaC is drugs like amiloride or triamterene, these drugs work here. And sodium hydrogen exchanger, it is blocked by the drugs called carbonic anhydrase inhibitors like acetazolamide. Drug of choice for glaucoma in adults. I'm not sure if the open angle glaucoma was asked or the closed angle was asked. Irrespective, I had discussed this in the important series. that closed angle versus open angle, who's the drug of choice. If it's open angle they ask, then the drug of choice is going to be prostaglandins like latanoprost, bimatoprost, etc. And if they have asked closed angle glaucoma, then the drug of choice would be pilocarpine. Okay. A 2-month-old pregnant female was diagnosed with Plasmodium falciparum malaria. What is the preferred management for this patient? If it's Vivax, we can use a drug called chloroquine even in the first trimester, right? But the question has asked Plasmodium falciparum. You all know that in falciparum treatment, we use the treatment called as ACT, artemisinin combination treatment or therapy. So the point is this ACT needs to be avoided in the first trimester, but we can happily use it in the second and the third trimester. We must avoid it in the first trimester. So what is the drug that is supposed to be used in the first trimester? Answer is quinine. Quinine needs to be used in the first trimester when it comes to falciparum. But if the question has asked Vivax, then the answer would have been chloroquine, right? Primaquine is absolutely contraindicated in pregnancy. We cannot use this drug. So this cannot be the answer anyway. If chloroquine alone was a separate option, then maybe for Vivax you could have chosen that. But if chloroquine plus primaquine was there, we could not choose it for the first trimester. Now, ACT should not be used in the first trimester. Primaquine cannot be used in the first trimester. And you know that doxycycline is also one more antibiotic we cannot use in pregnancy. There are very few antibiotics that we use in pregnancy like penicillin, cephalosporins, macrolides, etc. Remaining most of the antibiotics we avoid in pregnancy. So doxycycline is no different. Tetracyclines, they cause teeth and the bone damage. That's why we must avoid them. Once again, during the discussion of micro 25 important questions, if you go to that video and see, I have discussed even the treatment and I told you that the treatment of malaria is highly important. Make sure you all know this. What is the least likely side effect of amiodarone? Amiodarone, more than the uses, you must know its side effects. But this time they have asked both use also, side effect also. Least likely. Okay, this is the question. First thing guys, just 2 years back, we had a question on gynecomastia where the answer was spironolactone. And I'm sure everybody who has prepared for this exam knew the mnemonic called DISCO. DISCO drugs. And in the DISCO drugs, there is no A. That means amiodarone, cannot be the guy who's going to cause that gynecomastia. That means since the question asked which is the least likely side effect, then the answer is going to be gynecomastia. Now, other side effects are all caused by this dude called amiodarone. Hyperthyroidism as well as hypothyroidism, bluish skin discoloration called as Smurf skin or blue man syndrome, and a very lethal side effect called as pulmonary fibrosis. So all of these are, renowned side effects of amiodarone except gynecomastia. A patient who was on anti-tubercular treatment for the drug-resistant TB was prescribed bedaquiline. Now, this drug called bedaquiline is like a new drug for the treatment of TB. Which of the following ECG changes can be expected in this patient? So guys, the answer to this is QT prolongation. Although in the 25 important series, I had not mentioned the name of bedaquiline specifically, but if you can see, I had put a question that this QT prolongation changes are important for exam. That means the drugs that can cause QT prolongation. You can see I had given you some mnemonic also there, right? Whoever is having abs, they're cute. So cute QT prolongation. Antibiotics is written there. So you must have answered this based on this. Or if not, some questions, if we cannot do that, it's okay, right? We don't need to get the 100% in the examination, right? So it's fine. In fact, the newer drugs of TB like delamanid, pritomanid also, they also cause QT prolongation. Doctors, a patient who was taking treatment drug for the amoebiasis consumed alcohol and developed hypotension, flushing, nausea, vomiting. What is the most likely diagnosis? So after taking alcohol, some kind of problem is happening. So this is a very clean-cut indication of one thing that we all know about, disulfiram-like reaction. Once again, a question from our 25 important series. Very clearly, I've given you disulfiram blocks one thing called acetaldehyde dehydrogenase. And if you block this enzyme, acetaldehyde increases. I'll explain that to you in the next moment. See here, even in the antibiotic side effects, I had explained to you this guy's important disulfiram reaction. There are certain drugs who can cause this, like metronidazole, cephalosporin, anti-diabetic drug called chlorpropamide, antifungal like griseofulvin. So all these drugs can cause this reaction. So what exactly happens in this reaction is, when you drink alcohol, that is ethanol, it's converted to acetaldehyde by using one enzyme called alcohol dehydrogenase. Next, acetaldehyde gets converted to acetic acid by this enzyme called acetaldehyde dehydrogenase. First one is alcohol dehydrogenase, second is acetaldehyde dehydrogenase. So the drug called disulfiram blocks this enzyme. Now what happens is, if this enzyme is blocked and now you drink alcohol, ethanol will convert to acetaldehyde, but it cannot convert to acetic acid. That means this guy starts to accumulate. And when this accumulates, you get all those symptoms that were mentioned in the question. And this is known as disulfiram reaction. And why did we make this drug? It's a deterrent agent. That means the patient should develop fear of drinking, because whenever the person is taking this drug and let's say they drink alcohol, they're going to fall sick. That's why this drug was made. Somebody who wants to quit alcohol. But please remember, the patient themselves should be wanting to quit. That's it. So this was about disulfiram reaction. Once again, an anticipated question. Last FMG exam, they have asked the antidote in the alcohol toxicity. This time they have asked about this. And I told you specifically during my classes that there is going to be question from opioid toxicity, smoking, and the alcohol. And as you can see, the question has come. A 3-year-old child with GTCS presents with convulsions for more than 45 minutes. What is the appropriate treatment? So doctors, this question was slightly tricky. You had to pay attention. Many of us, if we would just read the word GTCS and jump to the conclusion, I'm sure most of you would have chosen valproate as the answer, probably option A or option B. Most likely option B you would have chosen if only GTCS was mentioned. Valproate followed by levetiracetam would have been appropriate. But please pay attention. They have given more than 55 minutes. Whenever the time is mentioned, please pay attention all the time. This is a classical presentation of status epilepticus. Remember, in our class notes also, I made you write the definition of status epilepticus. Time is given here. That means they're asking status epilepticus how to treat. And we have said that anybody having status epilepticus, the drug of choice is lorazepam, right? There are obviously many other drugs that can be used, but one of the best medicine is lorazepam. You may check our notes. One of the first thing in the table, in fact, is status epilepticus, how to treat, lorazepam, followed by levetiracetam. So the correct answer to this becomes the option D. And guys, let's say this 45 minutes was not mentioned, then your answer would be option B, B for ball, valproate by levetiracetam. Because many students have sent me this message, sir, time was mentioned and this was the exact time they mentioned. Then I guess option D would be appropriate. Which of the following is used in the treatment of pre or post-menopausal breast cancer? I'm not sure whether pre was asked or post was asked. I've given you few options. If premenopausal breast cancer was asked, then the drug of choice should have been chosen as tamoxifen. And if postmenopausal breast cancer was asked, then your answer has to be aromatase inhibitors, letrozole, anastrozole, etc. Another drug that they may ask you in the coming exam is something called trastuzumab. Trastuzumab is a monoclonal antibody that we use in the breast cancer. So this is the medicine that will block the overexpression of HER2 gene, which is responsible for breast cancer. Doctor, straightforward question from arrhythmia chapter. The drug of choice for ventricular tachycardia, what is the answer? Amiodarone. If you see our notes, very clearly I told you VT, the drug of choice is amiodarone, unless mentioned MI or digoxin induced. If they say MI or digoxin induced, then you may have chosen lidocaine as the answer. HIV positive patient who was given lamivudine, dolutegravir, tenofovir was recently diagnosed with TB and was started on ATT. What needs to be done for the HIV treatment? Now, unfortunately, I was not able to gather the proper options for this, like what was given, but I'm assuming the question was based on something called enzyme induction property of rifampicin. If you see the 25 important question series, this is where we discuss that the drug called rifampicin has caused the failure of another drug called OCP. And your rifampicin happens to come under the drugs called inducers, enzyme inducers. And I told you enzyme inducers cause other drug failures. So what do you need to do in responses? Assume there is a multiple drug regimen you're giving to someone and one of the drug is an enzyme inducer. It will fail some other drug. So what should you do to the other drug is increase the dose of the other drug, right? You should try to increase the dose of other drug. Since the drugs are failing, how can you counteract that as a doctor? Increase the dose. Keep the arrows in your head always. If there is an enzyme inducer, you as a doctor should increase the dose of the drugs that are failing. And if there was an enzyme inhibitor, who knows, next exam they may ask you this. What are you supposed to do as a doctor? Enzyme inhibitors cause drug toxicity. So do not give more dose. As a doctor, you need to decrease the dose. I guess dolutegravir was given in the options. Dolutegravir is affected by these enzymes. So if you're giving TB drug called rifampicin, the dolutegravir effect may go down, it may fail. So you must increase the dose of dolutegravir. That would be my take on that. Once again, the correct options I did not get. If you remember, please help me recall that thing. Once again, a question which was said verbally by many students, that there was a graph that was given, sir, in which the BP was shown to increase and the heart rate was shown to decrease. This basically describes noradrenaline, my friends. Noradrenaline increases BP. It is a drug which is a very strong vasopressor. It increases BP very efficiently, but the heart rate will go down. That's due to the feedback mechanisms that happen. Next, adrenaline, if you compare here, yes, it increases BP also, it increases heart rate also. And one more drug that we had discussed during our classes is isoprenaline. Isoprenaline, what it does is it increases your heart rate very high. Heart rate increases very high with this drug. So what you must know is heart rate is going to decrease by a drug called noradrenaline. It increases BP, but it decreases heart rate. Adrenaline increases both, whereas isoprenaline basically increases the heart rate very high. So this is something that may have been asked. Hopefully you guys were able to answer noradrenaline correctly. Straightforward question. I don't need to tell you this. You have written this name of the drug by your own hands in our classroom. Methylphenidate is the name of this drug. Drug of choice for ADHD is going to be methylphenidate. They have given a ECG for the PSVT case, and then they have asked what is the drug of choice. Sir, when you talk about PSVT, pay attention, it is VT, ventricular tachycardia. That means obviously the QRS is going to be affected. Narrow QRS would be there, because when you're having a tachycardia, heartbeats are going to be close enough. When you're having a bradycardia, then there might be gaps in between. Basic knowledge, right? And the heart rates is usually going to be beyond 150 when it comes to the case of PSVT. The drug of choice is something known as adenosine. I have told you this several times in our classroom that this is super high yield. Although it has a short half-life, we have ways that we can overcome that problem. And this is the drug I told you that is given by rapid IV push. A question from general pharmacology. A drug is having bioavailability of 25%. What is the inference of this? What does this mean? I don't know if this is the correct number they gave. Most people told me this. Yes, sir, this was the number. 20, 30, 10, whatever the number, I don't care. What is meant by this bioavailability? Let's take a basic example. I took a drug orally. Let's say this drug came into my GIT. And then this drug from the GIT will be first going to the liver. When the drug gets absorbed, first this drug through the oral route will reach the liver. And whatever the amount of drug you might have given to the patient, some drug is metabolized right away by the liver, which is called as first pass metabolism. That means even before the drug was able to produce any effect in your body, some drug already got wasted. This is called first pass metabolism. Now the remaining drug that comes into the system, which is able to be used, final amount of drug reaching the systemic circulation, which is able to be used by us, is called bioavailable drug. That means in this question, assume somebody had taken 100 mg of a drug. Finally speaking, how much came into the blood? Only 25 mg. That 25 mg is called bioavailable drug. Whatever the language they might have given this, even in Spanish if they gave, you must have been able to answer this. Amongst the antipsychotic drugs, which one has the least chances of weight gain? Now technically, the drugs called antipsychotics, more precisely atypical antipsychotics, they cause one side effect called LDS, lipodystrophy syndrome, where the patient have weight gain, diabetes mellitus, hyperlipidemia, a couple of things that can happen in this people. Now, this side effect is highest with certain drugs like olanzapine, and it is the least with the drugs like aripiprazole and ziprasidone. I don't know which one was given in the option. That would be the correct answer for this. Which of the following leads to acute hepatic failure? Now this question you could have easily answered by ruling out certain things. Sir, opioid poisoning. So many times, including in the 25 series, we have discussed that OP poisoning presents with a thing called dumbbells. Diarrhea, urinary excess, meiosis, bronchoconstriction, bradycardia, etc. etc. Morphine is an opioid. Opioid presents with a classical triad of three things. Opioids. What are they? Respiratory depression, pinpoint pupil, and unconsciousness. So you must remember this triad. Belladonna is nothing like atropine. And what is atropine? Opposite to parasympathetic. So this is stimulation of parasympathetic. This is opposite of parasympathetic. What is opposite of parasympathetic, my friends? Instead of diarrhea in the dumbbells, you will get constipation. Instead of urinary excess, you will now get urinary retention. So this is nothing but belladonna. We have discussed this in 25 important series again. Sir, bachaiye ek option. That is this mushroom called Amanita phalloides. So this is the mushroom toxicity that basically can target your liver. Okay, so you could have ruled out this one. Obviously not a direct straightforward question, but if you know the common poisonings like belladonna, datura, morphine, OP, we could have answered this question. Oral iron absorption is decreased by. Sir, the simple point here that you must remember is decrease in the acid, gastric acid, will decrease the absorption of iron, and increase in the acid increases the absorption of iron. That's why with iron tablets, we usually give vitamin C. What is vitamin C? Ascorbic acid. That means more acid, more absorption. Decrease in acid will lead to decrease in the absorption of iron. Now there are things like tea which contains substances like phytates, etc. that can actually decrease the absorption of iron. So last time they've asked about the antidote of iron, and this time they've asked about which one decreases the absorption of iron. So this tells us something, right? This is a message to all the dear doctors who are going to take this exam later on, that topics are going to be important rather than the same MCQ. I always emphasize during my classes, read the PYQ topic properly rather than just the PYQs. So that way, anything they stretch out, you should be in a position to answer. Sir, it's our obligation to do our duty. Later, the examiner can throw some twisted questions, etc. That is the expected thing. We cannot go to the exam thinking everything, is going to be easy, obviously, right? So thankfully, there were questions that were decent enough in this exam, and there were questions that were difficult. I accept that. But overall, when you come take the exam under tremendous pressure, after that, the exam will always feel like your enemy. But then when you sit back 1 day, 2 days after that, when you're in a relaxed mode and you look at those things, right, you realize that, yeah, it wasn't that bad. Okay. तो हमें हमेशा यही करना है दोस्तों, that we should always have good hope, good faith that we should be doing our hard work, whatever is required. Then leave rest to the God. Everything will be taken care of. You have done your fair share of hard work. You are going to do well in this exam. The good days are coming, my friends. Now, for that, let's all do the good deeds, right? So, as I requested you, once again, I'm requesting you, humble request, my friends, if there is any change in the language of questions, etc., without hesitating, please help us out here. Okay, so thanking you in advance for that. Drug of choice for the treatment of migratory polyarthritis in acute rheumatic fever is, sir, they have given arthritis. Arthritis means inflammation. Inflammation needs to be treated with anti-inflammatory drugs, and from all of this list, aspirin is the only anti-inflammatory drug. Benzathine penicillin, although is a drug of choice, is an antibiotic for rheumatic fever, but since they asked arthritis, that's why we are going to choose aspirin. Now, these are some questions which I usually call as brownie points question. The brownie points mean something that is extra. This, I'm not claiming this is from pharmacology or anything, my friends, just something what we usually discuss in my classes. I'm just telling you that this was there in our exam. A female presented with 5 days of unprotected sexual intercourse. What is the best contraceptive method for this patient right now? Guys, there are some contraceptive methods that are given here. For example, misoprostol. This is given usually within 3 days of unprotected sexual intercourse. OCPs can be given within 3 days, or the most famous drug for emergency contraception within 3 days is this drug called levonorgestrel. Yes or no? So this is also given within 3 days. That means these cannot be the options. Right away, I can rule out these two. Ulipristal is that drug that is effective until less than 5 days also. That means 5 days tak ulipristal could have been given. But since the question says after 5 days, the undisputed champion in this is going to be the IUCD, intrauterine contraceptive devices. That means irrespective, the knowledge of gynae, the knowledge of pharma, everything combines when you are a doctor. We cannot say that this is this, this is that, right? Just I'm saying, like, we could have ruled out if we knew our pharma well. Once again, something that we know from our classes, which of the following is not a feature of Conn syndrome? So, pehle to Conn hai. Who is the Conn syndrome? Conn syndrome is nothing but excess aldosterone. Now, when you have too much aldosterone, what is the job of aldosterone? Save sodium, right? The job is to save sodium, obviously with water. This is one thing. And it excretes potassium. It excretes potassium as well as hydrogen. This is the job of aldosterone. So now if you have excess of aldosterone, you will save excess of sodium called as hypernatremia. And then you will start excreting excess of potassium. If you lose potassium, it's called hypokalemia. And H plus being a acid. If you lose so much acid from the body becomes alkalotic. If you lose acid, your body becomes alkalotic. That means Conn syndrome will have alkalosis. They asked which one is not a feature. So obviously acidosis doesn't happen. A patient presents with sudden onset chest pain and was later diagnosed having inferior wall MI. What is the best treatment of this patient? Dr. Saab, once again, I hope you are all reminded of a cardiac surgery video I showed you during my classes, right? You all became advanced doctors by looking at that cardiac surgery, remember? So there I had explained to you that angioplasty or PCI, percutaneous coronary intervention, those are the procedures that we will always prefer when it comes to MI, right? Followed by the drugs like thrombolytics. So thrombolytics are also in this option like streptokinase, altiplase, etc. But we will always choose angioplasty. Angioplasty, we have said the word right, nothing but your PCI. So there we go now. We'll discuss the micro question starting from now. 23-year-old female with rheumatic heart disease now is diagnosed with bacterial endocarditis. Gram stain of the organism is given below, which is the most likely organism implicated. First, they have mentioned rheumatic heart disease. That means there might be some problem in the heart already. Then this person is getting endocarditis. So you must know this must be a case of subacute bacterial endocarditis. So guys, I really hope that you guys answered this correctly. First, in the gram stain, if you pay attention, purple chains, round organism in chain is mentioned. That means this must be a gram positive cocci called streptococcus. Because it is in chains, it must be streptococcus. So streptococcus, if it's the answer, then already aureus is ruled out and epidermidis is ruled out. Now I remain with Streptococcus agalacti and viridans. So guys, from these two organisms, you know viridans is the organism that causes endocarditis. In fact, it is the most common organism causing subacute bacterial endocarditis. Subacute means the valve may be already damaged, some kind of cardiac problem must be there, and they have already described some kind of a heart problem, right? Following which endocarditis happened. And it's also the most important organism for late onset prosthetic valve endocarditis. You can see in our 25 important question series, once again, there was a classical case that I have mentioned, rheumatic heart disease. Entire case scenario, how they will ask you the endocarditis by giving words like vegetations or this splinter hemorrhages, Roth spots, etc. Then I also gave that maybe not this time. Last time they asked this kind of a question, right? This positive, that negative. Last Fmge they asked like that. This time so straightforward, they've given viridans. So the correct answer for this was viridans according to that similar question I had discussed here. Next question, doctor, for which of the following Amsel's criteria is used for the diagnosis? Straightforward, I'm positive all of you have gotten this correct. The answer to this is bacterial vaginosis caused by an organism called Gardnerella. This is a screenshot from our 25 important series. I had a question put exactly on this. That is bacterial vaginosis caused by Gardnerella. Something called Amsel's criteria is used. So I'm sure now you understand why is it important for watching those important series, because all the faculties, they put their hard work so that you guys get the benefit out of this. HIV positive patient presented with fever, headache, etc. Microbiological examination showed India ink stain positivity. What is the likely organism? Closed eyes, you can answer this as Cryptococcus neoformans, India ink stain. HIV positive patient, all that they have given. So now if you just look here, once again a question that we had here, India ink stain pe in our 25 important series, answer Cryptococcus neoformans. I told you, when the CD4 count of the patient is less than 200 in HIV, that's the time this infection could come. Another important dude that comes at that time is a respiratory infection, pneumonia, by an organism called pneumocystis. Female presented with curdy white discharge. Microscopic examination shows yeast producing pseudohyphae. This is the word that they gave. Which is the most likely organism? Answer, Candida. Let's not go far. Once again from our 25 series, cheese-like discharge, as you can see in the question. Next, I had given the exact word pseudohyphae. Answer, Candida. A patient presented with signs of meningeal irritation. CSF analysis shows increase in the protein normal glucose and lymphocytic predominance. Sir, I've always told you, if you see decrease in the glucose, then you must know it is bacterial. In the bacterial, once you know there is decrease in the glucose, look for the cell. If you see neutrophils, what you call as PMN, then it is called as pyogenic meningitis caused by guys like Streptococcus pneumoniae, Neisseria meningitidis, etc. But if you see lymphocytes being mentioned, then that's called TB meningitis. But for this to qualify, glucose must be less. In the question, they had mentioned normal glucose. Normal glucose is found in viruses. Viral meningitis is normal glucose and lymphocytic predominance. So the correct answer, if the question that was told to me was normal glucose, this is the correct answer. But if they gave less glucose, then you could have chosen your TB meningitis. Exactly this question I had put in my last 25 important question series. You can see in this question I had given there is normal protein and glucose. Leukocyte count is whatever, that is lymphocytes. I had very clearly explained all of these things in this place. Next question. A patient had a thorn prick in thumb of the right hand, after which the nail got swollen up to the axilla, probably until the shoulder. Which of the following organism is implicated in this? Guys, obviously two hints given here: thorn prick, Rose Gardner's disease, or sporotrichosis. As we know, this disease, the ulcers keep spreading along the lymphatics and they may extend beyond the level of origin. This was the exact question that was discussed by us in the 25 series. So here we are. This is the ulcer. The picture also you can see that I had given earlier. In this question, my question was slightly more deeper. I had asked like what is the body used to diagnose this, where the answer would be asteroid bodies of sporotrichosis. But here I believe in this question they have just asked what is the diagnosis. The answer was sporotrichosis. If they ask the organism is called Sporothrix schenkii. A patient presented with painless genital ulcer and the bubo is seen. Which of the following could be identified? Now, STDs are a definitive question in our exam most of the time. So you got to know this one table that I have discussed. I have already highlighted bubo word. If they give you an exam, it might be either chancroid or LGV. Now the only difference is one is painless ulcer, one is painful. Chancroid is painful. We remember chancroid is D for do cry, patient do cry because it is painful. Painful plus bubo would be chancroid. Painless plus bubo, it is LGV. So the correct answer to this question is going to be LGV, doctors. A patient from Kerala who lives close to the palm trees presented with fever, headache, etc. What is the most likely diagnosis? So guys, a very anticipated question this time. I had told during all my classes that since there was an outbreak of this thing called Nipah in Kerala recently, they would ask you this question most likely. So Nipah virus is the correct answer. You can see I told you there was an outbreak first in 2018 and now this time in 2023 in the same district, Kozhikode district in Kerala. So this is the question I told you is expected, that was in our exam. So touch wood, God has been very kind. I'm not trying to brag or anything. This is just to show you that when we tell you something, it is based on the experience and we are always trying to help you guys so that you pass and get out of here as soon as possible. Which Plasmodium species affects brain? Quite an easy question again, sir. Falciparum. Falciparum is the most serious type of malaria. As you can see in our notes, when we learned malaria topic, I told you there are some basic symptoms that you can see with all organisms causing malaria. But there are some symptoms that you see more specifically with falciparum. For example, CNS involvement, it is seen with falciparum. CBNAT detects resistance to which of the following drugs? Now you must be knowing CBNAT is something that we use for diagnosing tuberculosis. It's nothing but PCR. Now this PCR machine called Gene Expert or Gene Expert RIF, I've always told you that the name Gene Expert RIF is a nice name because it helps you remember RIF word for rifampicin resistance. That means the correct answer to this is rifampicin. You can check out, this is the excerpt from our note. PCR or the CBNAT, we have learned that if the patient is TB positive, this dude can even check for a gene mutation called RPOB gene mutation. If mutation is present, that's the bad news. It's called MDR-TB. And if the mutation is not present, then that means it's the routine TB called as drug-sensitive TB. A patient got bitten by a mite, following which the patient presented with fever and a eschar. What's the most likely diagnosis? Eschar word has been given. The correct answer to this is scrub typhus. Although many of us might have been tempted to choose even anthrax because that also presents with an eschar. But if you pay attention, the root of infection is mite. They have given this mite. Now, rickettsial infections, there is some vector involved in them, like mite, flea, etc. So here they have given mite. So obviously, no doubt, scrub typhus would be the correct answer. Precisely based on this eschar word only, even I had given one question to you earlier in the 25 series, but I did not mention any vector or anything if you pay attention. I had given you a hint like this person comes in contact with leather. Leather means this person must be coming in contact with the skin of animals, zoonotic disease. Eschar say there are two diseases, either it is anthrax or it is going to be scrub typhus. Control for the ETO sterilization. Ethylene oxide. This is a question from sterilization topic, as we usually expect one question from this. The answer is right here. I don't know what were the other options given. Bacillus globigii or atrophaeus. This is the bacteria that we use as a control. I always emphasize, like, have a good look at these two topics. One is plasma sterilization and ETO, just last minute before exam. A patient having pet dog presented with pain in the abdominal area. Further examination reveals cyst in the liver. What is the most likely organism implicated in this? Right? Cyst word, dog word. What more hints do we need? Dog tapeworm. They're talking about Echinococcus granulosus. This is the worm called as dog tapeworm. It is a cestode, and this one causes cyst in your liver, right? Hydatid cyst disease is the name of this disease. Cassoni's test, all these things that we had learned, this is the organism. Another organism which presents with cyst in the brain, neurocysticercosis, that is caused by Taenia solium. A female presented to the OPD and was diagnosed with a genital infection. In which of the following the partner also needs to be treated? So this is the STD in which both male and female needs to be treated, and that's nothing but your trichomoniasis. Once again, quite a repeated type of MCQ. Trichomonas, they love to ask questions on this. Like 2 years back or maybe 1 year back, they have asked one question on trichomonas. Basically, this is a parasite. So basically this parasite, it does not have a cyst stage. It only survives as a trophozoite, and these trophozoites are transmitted sexually. So that was the question they have asked in the last year. Reservoir for organism implicated in the Kala Azar. Now, something more like a bouncer, I would say. Normally speaking, the Kala Azar vector called Leishmania donovani. This organism is present in animals only. But in India, mostly that what we found is the reservoir is human beings. So this is the correct answer for this. Reservoir of Kala Azar is going to be humans itself. That should be the correct answer. I know this is something more like a bouncer question, but again, whatever it came in the exam, so we must address that. Usual question is LD bodies, etc. that they may ask. Now, one more question that was asked from the modified Duke's criteria for the infective endocarditis, like what samples or how many samples need to be collected for the blood culture. See, if anybody is suspected to have infective endocarditis, we must take their blood samples. So 2 to 3 blood samples, meaning 2 to 3 times we collect the blood sample. That means 2 to 3 sets. I don't know if that was the exact language used. We cannot just take one blood sample and expect to find the organism. We have to take at least 2 to 3 samples, and that too, all of this needs to be done before we start the patient on antibiotics. And in that sets, there will be 2 test tubes, you must know, one for the aerobic and one for the anaerobic organism. So different culture media we are going to provide. So however this language was asked, I'm not sure. This is supposed to be the correct answer for this. 2 to 3 samples we are going to take, and each time the sample will have one for aerobic, one for anaerobic. So basically this finishes our session of recall, my friends. Once again, I'm hoping this brings us at least some joy that many questions you must have answered correctly from this. we should not even expect to answer everything that is 100% to be correct. Why take all that burden and create pressure on our head? So as you can see, micro and pharma combined, approximately there were 45 questions. Whatever you may call it, some questions were integrated with some other subject or whatever. But from that, if you have answered a decent number of questions, so obviously these subjects are going to be a great contribution in passing your examination. So we always emphasize there are some subjects we may like, we may not like, but you need to study them. Examiners love to ask this. Micro pharma has always been, examiners' friends. They will ask question from this. So ढंग से पढ़ के जाना है. Irrespective, whatever has been done. All the praise we have been doing for you, your parents, everyone has been praying for you, my friends. Do not worry too much. Don't stress too much. You guys are going to crack this exam for sure. Soon enough, the good news is coming for all of you. Okay. And I really hope the contributions that is done from our side also, you guys are able to recognize that, and do make sure that when the result comes, one message that you leave that, sir, I was in your so and so class and I've passed. All right. So irrespective, you may have been in our classes or not, it's okay. You may just send us one message that, sir, I watched your YouTube video and I have passed. I know I may not have done a great contribution in your life, but it will make us happy that you guys are moving in your direction where you wanted to, that your dream is coming true. This is the thing that we want from all of you, nothing more from this, my friends. Wishing you all the very best. This is my Instagram account. Just add me by dr_solk. In that page, we usually have questions, etc. that you can solve. Please follow me up there, and any queries, I'll be happy to solve them. Thank you very much. Best of luck once again.